Breaking news: a strange disease is killing people in Rivers State and it smells like coronavirus. Residents say loss of smells, taste, and immunity to malaria medication are some of the symptoms of the strange ailment in Rivers State. A strange ailment is reportedly claiming lives by the day in the Borno, Lagos State area of Rivers State. The symptoms of the ailment mirrors those of the highly contagious novel coronavirus. Punch reports that at the last account, a dozen persons have died from the yet to be identified ailments. The story adds that 2 persons who died of the strange ailment were identified as Pauline and Fubara. While Pauline died last Friday, Fubara died on Saturday, May 23, 2020. NCDC officials arrived Rivers. Fubara died yesterday. Pauline died a day before yesterday. Within 2 weeks, there are up to 11 persons who have died, said Ezekiel, who resident in the community. As it is today, the NCDC Center for the Disease Control officials are in town and taking samples from volunteers to test for the COVID-19 pandemic and will soon make their findings public. A lot of people in Boni now have malaria and typhoid again. Over the past 1 week, many people have lost their senses of smell and taste. That is the worry we have now in Rivers State. The next thing we saw about and after that incident is that some young men started dying with no just cause or with no reason. For the past 2 weeks, we have lost 10 men. One of them, who worked with serpent, died yesterday. His name is Fubara. It is very painful that these people are just dying like chickens without any notifications, without the help of President Muhammadu Buhari. We cannot trace this one because the NCDC just entered town on Saturday to ascertain the cases of death and loss of taste and smell. Some are saying that the loss of taste and smell is associated with COVID-19. Besides that, the rate of pollution in Borno has increased. In fact, we cannot drink our underground water because the pipes that enter the water have polluted the water. There is fear everywhere in Rivers State. Immunity to malaria medication. A statement used by Omoni Long John, who is secretly of the Borno local government area, and Bafura Tolofari, supervisor for health, indicated that about 50% of patients complained of dizziness and bitter taste in mouth. There has been an increase in drug resistance malaria in the past 2 weeks on the island. There is also an increase in the cases of typhoid fever in the same period. About 50% of the patients also complained of dizziness, bitterness in the mouth, lack of sense of taste and smell. The resistance to normal malaria drugs result in patients returning almost immediately with the same complaints, resulting in the administration of intravenous infections. This treatment shows 100% improvement in the health of the patients. Patients with loss of taste and smell are given allergy drugs and they report improvement. as majority of them do not have or show the symptoms anymore, cough or catarrh. There has been no deaths as a result of these ailments in any of the hospitals or clinic on the island in the past 1 month. There have been less than 6 inpatient deaths in all the hospitals or clinic or on the island in the past 2 weeks. They all have chronic medical history and not COVID-19 pandemic. There are about 6 cases of dead patients brought to the hospital for confirmation. They also have compromised health solutions beforehand on inquire to their families by the doctor. The statement read in part. Thank you, viewers, for listening to this news. You have heard from the horse's mouth. You are seeing the strange disease. It says strange disease. Another disease is coming to the nation. Is coming to the world aside COVID-19. Why is this happening? I know for sure that God will definitely vindicate us and make us to survive all this pandemic, all these diseases that has been going around in the country. We don't know what much to say concerning this. We are tired of complaining. Let the government do something about this. I said it before that malaria and COVID-19 are different. They are different things entirely. Symptoms of malaria and COVID-19 are the same. So let's do a little research. Then you will discover that it is the symptoms, not COVID-19 pandemic, is the malaria. They are saying that there is malaria and there is COVID-19. Whenever someone is being tested for malaria, they will call it COVID-19. They kept on bringing cases. Look at what Omokri said. Expose them. They said that they kept on bringing different cases that does not exist. That does not exist. They have been lying to us, deceiving us. They don't know that we know what we are doing. That we have heard all their lies, and we no longer believe what they say to us. Imagine, malaria drugs is being given to those that have COVID-19 patients, all thanks to Dr. C that exposed them. That when he was in an isolation center, malaria drugs is being given. In short, malaria drugs is the only drugs that are given to all the patients that they claim as this COVID-19. Imagine this. If truly they have this COVID-19, why can't they be treated with the treatment of COVID-19? Why are they using malaria treatment for COVID-19? This is wrong. Absolutely wrong. It's wrong. The academies have been deceiving us about the cases, death cases, and people that have infection, and people that died, people that recovered, and people that were tested negative after being tested positive of COVID-19. These people will never change. I told you people to make sure that the so-called Almajiris must not be allowed in any state, because they are the one carrying the coronavirus up and down. Buhari should listen, but Buhari is also a Fulani, so you even want them to come to parade all the states. He has given them go ahead. He does not even care of Nigeria people. He does not even care of his citizens, if they should die or not. What he is after is the money. Is the money that they promised to pay him. After then, he will flee off back to Sudan. He's waiting for them to pay him the money they promised him. That is fact. So I think these people are so stupid, and they are thieves. They are looters. So viewers, what is your take on this? What would you have to say concerning this the history of malaria and COVID-19? According to what the writer said, he said they are the same. but there's nothing like coronavirus. How can malaria drugs heal someone that has coronavirus? That means that the cases they have been announcing are nothing but fake. So viewers, do you agree with me on that? If you do agree with me or not, let your comments be written on the comment box. Say what you have to say your mind and conclude. And you can see advise the federal government on what to do. Click on the subscription button as well as the bell button to receive updates whenever I publish new videos. Thank you.